President Biden will be tested for COVID-19 again today after a White House staffer received a positive test result on Monday. The president has already tested negative since being in close contact with that aide. This as Mr. Biden unveiled new plans yesterday to fight the rapidly spreading Omicron variant. Those steps include, as we've been talking about, 500 million free at-home testing kits, mobilizing military troops to help overwhelmed hospitals, and adding more testing sites. Ed O'Keefe is at the White House with the latest.
Anne-Marie, good to see, as you said, the Biden administration picking up the testing program across the country. New York City will be first. Other areas of need will come after that. But all of this comes as the Omicron variant is spreading, and there are now questions about whether the White House responded fast enough.
We should all be concerned about Omicron, but not panicked.
President Biden tried to reassure the nation Tuesday and issued a stark warning to those who don't have shots.
If you're not fully vaccinated, you have good reason to be concerned. You're at a high risk of getting sick. And if you get sick, you're likely to spread it to others, including friends and family.
Research shows that the risk of household transmission is nearly 3 times higher than the Delta variant. Mr. Biden also said 500 million at-home rapid tests will be mailed to Americans who order them from the government for free online starting next month. But officials can't yet say how quickly the tests can be ordered and distributed.
We are working through all those very important details right now.
The administration's trying to avoid scenes like this, long testing lines in Miami, Cleveland, and Los Angeles. And the president dismissed concerns his administration should have expanded testing options sooner.
The Omicron virus spread even more rapidly than anybody thought.
But just hours later, the CDC director said this.
We anticipated that we would be seeing this kind of increase from 3% of cases to 73% of cases in around this period of time.
So you're saying you knew this was coming?
We have been following carefully the science, and we have been working hard as we anticipated this.
Now, aides say he's not showing any symptoms, but the president is set to be tested again today for COVID-19. The big reason is because last week he was in close proximity to what the White House calls a mid-level staffer who tested positive for the virus on Monday. The president was tested on Monday. He tested negative. Following CDC protocol, 5 days after that exposure, he's set to be tested again later today. Anne-Marie?
All right, any idea, Ed, when we might get the results of that test? And also, how's the staffer doing?
We don't know on either front. We do expect the White House will let us know either way. And when it comes to the, as they described it, mid-level staffer, the deal is that they don't disclose the situation with people like that. They would only let us know in the case of the top 4 around here, the president, the first lady, the vice president, and the second gentleman.
Yeah, that makes a lot of sense. That is that person's private health information, so
right.
I can understand that. So let's get to the administration's new plan. When are we going to start to see some of these measures take effect? These tests being made available, the military being deployed to help hospitals. When is this all going to happen?
Let's start with the military medical professionals. About 1,000 of them are ready to go to places that are going to see hospitals get overwhelmed. Already FEMA has deployed a handful of strike team members to 6 different states in the upper Midwest and out west that are seeing a bit of a surge and need the assistance. The military medical professionals are ready to go as well. They're probably, excuse me, going to end up in communities where the hospital system simply just can't deal with the crush. But again, part of the thing we got to remember here, there are not definitive answers for a lot of what I know you're going to be asking me, in part because the data is still coming in. And note that so far we've seen hospitalization rates are not going up as high as they had been at the first wave and in the Delta wave. So the hope is that while these medical professionals from the military will be available, they won't necessarily be needed en masse in too many parts of the country.
Yeah, fingers crossed on that one. So now I want to get to what we saw in your story, what appears to be sort of almost contradictory statements between President Biden and the CDC. We saw in your story how the president said, hey, listen, we didn't anticipate that this Omicron variant would spread so rapidly. But then Dr. Walensky from the CDC said, no, we were following the science, and we absolutely knew that it was going to spread in this way. I feel like this administration has been struggling with sort of clear communication, not just this administration, but, both this one and the one before. But these sort of contradictory statements, you know, at a time when people are looking for clear answers that may not be available, as you point out, because the data is still coming in, how, for lack of a better word, it might be a strong word, but how damaging can contradictory statements like this be?
Well, they're already being seized on, so it's clearly done some damage. And the irony is that this came in response to a question from a reporter as the president was getting ready to leave the room. He even admitted in that impromptu Q&A that went a few rounds that he wasn't supposed to be taking questions. I think you can understand now, if you're on the comms team here at the White House, why it is they prefer that he not allow himself to get trapped into these situations where he says things that then have to be cleaned up or clarified later, and that's what they're going to have to spend some time doing today. Here's the thing. The president was read into and talked about the Omicron variant for the first time on Black Friday, the day after Thanksgiving, when he was on his vacation up in Nantucket. He said he'd be updated on it over the course of the next few days, and he had about 4 briefings over the course of 3 days. Why, at that point, this kind of stuff didn't start then, you know, we may never know, or it's going to take some while to sort that out. But you clearly see the scientists saying, no, we knew this could spread quickly, and the administration responding now as the cases are surging, and we know that these tests that the administration is planning to purchase and distribute, 500 million of them, aren't going to be available until some point in January. We don't know what day. We don't know how you're going to order this, where you're going to order them from. All they say is they're setting up an online system. And I asked, and there was no clear answer yet, and that's fine because it's not January yet. They haven't finalized all the details. But how quickly will it go from you ordering it on your computer or your phone to getting to your front door? And that'll be another big question that has to be answered. And all of this, again, an example of the criticism and concern many had expressed over the course of the pandemic this year. It said, look, testing sites barely exist anymore. We're not testing to see where this thing is, how quickly it may still be spreading. Remember, a lot of towns, cities, and states shut down their mass testing sites in favor of vaccination and booster sites. But by shutting down all that testing capability, it's now being ramped up again around the holidays and at a time when this thing is spreading like wildfire.
Yeah, and the demand has ramped up significantly too. Hey, just a really quick question, and just forgive me if you already sort of clarified this, but you know, you hear testing. There are all kinds of tests out there. The rapid test that you can get from like your local pharmacy. There's a PCR test, the one that goes up the nose, but there's also a saliva version of that I didn't even know. Do we know exactly what type of tests are going to be distributed?
Nope, we don't. You know, it's likely to be one of those at-home ones where you can, you know, stick it up your nose yourself in both sides and then put it into some kind of solution and pour it into the thing and wait 15 minutes. But they haven't specified quite yet. There are 8 approved by the FDA. Those are the 8 from which the administration will be drawing. So it's this version right there that you're seeing here in the stock art. It may also be the spit test. So they will draw from the supply that currently exists and that's being ramped up. That was authorized in late November, the ability to do so. So we'll probably hear more about that in the coming weeks. And then, of course, you know, we'll see whether user error, of course, gets in the way because not everyone necessarily can figure out how to do this. And so there's going to be some concern about that as well. You don't want to waste the test. But clearly, a lot of questions like that yet to be answered.
Yeah, definitely. Hey, before we let you go, some non-COVID political news to ask you about. Senate Democrats met virtually yesterday evening to discuss a way forward for the Build Back Better plan. How did that meeting go?
Well, in the words of one senator I checked with, they said it was, quote, constructive. They wouldn't share much more beyond that. And we know that Majority Leader Schumer said, look, they're still going to hold a vote and try to debate, or at least begin a formal debate on Build Back Better, the plan that Senator Manchin, who you see there, has said he doesn't support. What's likely to happen is that they will take the existing text, they'll, you know, open up a new Word document, start typing, copy paste that modified version into the existing bill, and then try to see if that works and send it back over to the House. The question will be the politics of the Democratic Party and congressional Democrats. Do the changes in the Senate jive with what people in the House would want? A far more liberal body, you know, that reflects the ideological spectrum of the Democratic Party far more. But either way, they say they're going to try. The other thing they're going to try for, as they've said, voting rights. If Republicans block the legislation, the Senate is going to try to have a debate on changing its rules. But remember, 2 members of the Democratic caucus at least, Kyrsten Sinema of Arizona and Manchin, have said they don't want to change the filibuster in any big way because they know that at some point things could come back to bite the party that's currently in power when they're in the minority, and they just feel that that's just not the way the Senate should operate. But other Democrats have been pressuring these two, saying it's time to establish some kind of what they call a carve-out or an exception for voting rights style legislation. Sinema was quoted last week as saying, look, we may do what we want to do next year, but what's to say in a few years Republicans won't come along and reverse it all by using the same exact rule. She's got an interesting point there, and that'll be part of the debate.
Yeah, definitely. Ed O'Keefe, thank you so much.
Take care.